Hi, everybody. Let's take a quick look at Section 3 of the NOAA White Paper in Clinical Services. And you were asked to read this a couple weeks back. And I know that our visiting lecturer is going to speak on this subject. My hope is you'll just impress the visiting lecturer very much with what you know. So we're talking about in clinical services, the creative art therapies, and it's a broad overview. It might be quite relevant because I'm so happy to hear that many of you are going into the therapies profession. And so when we talk about the CATS, as you've heard me mention in class, um, it's a distinct and regulated health profession that addresses the needs through a specific art form. And those include art therapy, drama and movement therapy, dance and movement therapy, that makes more sense, drama therapy, music therapy, poetry therapy, and psychodrama therapy. So within all of these different therapies, under the umbrella of creative arts therapy, there is a definition, a nationally agreed on definition of the profession, a legally defensible scope of practice, educational competencies of things that you must learn over the course of studies, a standard of practice when you're in that profession, a code of ethics that governs the work that you do, and evidence based research. And some of these terms or phrases have become familiar to you because I first started talking about artists in healthcare. And the recent, the upcoming, what am I trying to say? The upcoming release of Code of Ethics and standards for arts and health professionals is going to be a very big deal for artists working in healthcare because um, without being therapists, we're still joining the ranks of a highly professional field. And as you have known now through the reading, these creative art therapies have been around for a while, and so they have established and set the course for those professions coming up behind them. So that's the common list of the therapies within the CATS, and then within those fields, when we talk about a very distinct regulated health profession, the list on the right hand side of the slide would be the types of things that you would look for to learn more about a specific field and gain an understanding about how to utilize those professional documents through your course of study and advanced work. So they come to the field as highly trained professionals. They gain qualifications through, like I said, extensive coursework as well as supervised clinical training. And broad strokes, the creative art therapies enhance self-awareness, foster health, communication and expression, promote the integration of physical, emotional, cognitive, and social functioning, and facilitate behavioral and personal change. Those are really broad terminology, but you can see the similarity between health and wellness, um, but they go above and beyond with the specific um, assessment and treatment and ongoing evaluation that is aligned with clinical practices. So, the mastery quiz that you'll be taking is all about the interpretation of this table called Creative Art Therapy's Professional Overview. And you'll see that um, the professionals that are represented in this table are all trained both as artists and as therapists, and that they've completed their course of study, either undergraduate, graduate, in some cases even doctoral level. Um, they practice in compliance with these standards and code of ethics. They maintain their credentials or certifications, and many hold state licenses within their profession or mental health license. And you'll be hearing from our guest that that varies from state to state, and it involves a tremendous amount of hours learning, being supervised, assessed, so that that once you're awarded the professional license, you're able to withhold those standards of the practice. So it's interesting to see the settings for creative art therapies. It's very much like artists in residence. I will say that uh, therapists are distinctly trained to handle acute and crisis and some of the highest risk behaviors um, and physical conditions, which is very different than what artists bring to the table. So we see them in adult treatment centers, community mental health centers, community residencies and halfway houses, correctional and forensic facilities, disaster relief centers, drug and alcohol programs, early intervention programs, general hospitals, home health agencies, hospice, neonatal nurseries, nursing homes, outpatient clinics, psychiatric units, hospitals, rehab facilities, senior centers, schools, and wellness centers. Some of those are very similar where you would see artists, but it's interesting, I think, to read the list out loud with you so that you can recognize that some of you getting the OT or the geriatric studies or the social work. We've had um, kinesiology majors, all of that PT, drug and alcohol treatment, all of that can inform, the arts can inform um, the work and the service that you do professionally. It just adds to your toolbox. And so I'm excited that I see such a variety of students attracted to the field from a lot of different disciplines because um, it's a non-invasive and restorative response to people with health conditions, and so um, you end up having the opportunity to treat the whole person with this specialized and advanced training. So although I don't speak to you as cats, um, I recognize the value and encourage those of you that are drawn to that field to follow. So I'll go through the different therapies very briefly, just to warm up your ears to the language. I know you've read it, but sometimes that repetition really makes the content sink in. So art therapy, the American Art Therapy Association was founded in 1969, so about as old as I am. And art therapy engages the mind, body, and spirit in ways that are distinct from verbal articulation alone. Kinesthetic, sensory, perceptual, and symbolic opportunities invite alternative modes of receptive and expressive communication, can circumvent the limitations of language. Wow, that is a complex sentence. So to me, that's just saying that we go nonverbal when we make things. And so we use our body and we use touch and we use our senses. And the good news is It can offer a language, a true language for people to share themselves, which is above and beyond the vocal. I have to say that art making too is deeply based in symbolic expression. So when I read this definition, it's just a level of degree that artists contribute very similar things. I just noticed that a therapist would have a different intention by bringing um, that expression to others to help heal. Whereas an artist um, might have or provide healing experience, but it wouldn't be up to an artist to assess or determine or even to expect that. It's just, it can only be a happy byproduct. Whereas the therapists have that specific target or goal and are constantly evaluating and assessing their progress. I hope this makes sense. My hope is that a little bit of discussion will help make some of these complex sentences or ideas a little bit more palatable. So in dance and movement therapy, the American Dance Association, which is the overseeing organization, was founded in, again, mid-60s, 1966. The psychotherapeutic use of movement as progress or process which furthers the emotional, cognitive, physical, and social integration of the individual. So that's the process of moving. The act of guided movement would, it's sounding like they're talking about balancing the thoughts, the body, and the social integration of a single individual, based on the assumption that the body and mind are interrelated. The dance movement therapist focuses on movement behavior as it emerges in a therapeutic relationship. Now that is something that would be very interesting to watch. I wonder if in some of your portfolios you might include examples from YouTube or TED Talks or something like that. Body movement simultaneously provides means of assessment and the modes of intervention. Makes me think that the next time I share this lecture, I should have links giving examples, because these are all such beautiful art forms. I would imagine that the therapeutic event, the part that can be shared with the public and still respecting the patient's privacy, would be very interesting and beautiful to look at. Okay, in poetry therapy, the language-oriented branch of CATS focuses on, but that's growth and healing through the reading and facilitated discussion of carefully selected literary works and expressive writing activities. We've done a few in this class, mainly for personal expression, but know that poetry therapy or literary works are based on a broad range of styles or types. So they are using poems, stories, memoirs, and other genres to find ways for people to elaborate on meaningful metaphors, there's that word again, or symbols, and gain fresh meaning from significant life stories. Sorry about the design of this slide. Drama therapy and psychodrama therapy. So the North American Drama Therapy Association was founded in the late 70s, and the American Society for Group Psychotherapy and Psychodrama was founded in 1942. So that the ASGPP obviously came well before the American Drama Therapy Association. It's a dynamic method of working with the client populations in a playful, embodied manner via the accessing power of metaphor. And metaphor, let me look up a good, easy definition, although maybe you could tell me what it was. It's a figure of speech in which a word or phrase is applied to an object or action which is not literally applicable. I've fallen through the trapdoor of depression, said Mark, who was fond of theatrical metaphors. Figure of speech, a symbol. Let's see. So again, a word or phrase that's a stand-in, a symbolic equal. And certainly that's the one of the basis of art forms and higher order thinking in metaphor. The intentional use of drama and or theater processes to achieve a therapeutic goal, rooted in fields of psychology, psychotherapy, occupational therapy, theater, creative dramatics, psychodrama, and applied theater. Provides treatment through improvising scenes, role-playing, creative and projective play, or creating performances with the intent to raise awareness, change attitudes, expand life roles, and rehearse possible solutions to issues of concern. One of the great clips I saw of drama therapy was a theater troupe that came into a hospital and created performance about compassion fatigue, and it was I believe it was the nurses and doctors and staff that wrote it and created the costumes and then performed it as well, to not only the audience that worked in that facility, but I think community members. And it was quite moving because, as you can imagine, our healthcare providers are some tough and highly skilled individuals. I find when I do care for caregivers events, I have to really be on my toes to provide something that is meaningful and challenging and holds their interest, because they're not to be, they're not to be trifled with. They've done a lot to get where they are in their profession, and what I'm trying to say is they're smart people. So I'm thinking of a piece that I created for them to do at a department managers meeting, and they've invited me 2 years in a row. And the first one, I had the punchline of the story is that I'd given them an hour and a half to complete this project together, and they were done in 20 minutes, and they needed no directions whatsoever. They figured it out. So heads up, heads on a swivel when you make something for caregivers. And music therapy, I think we'll end here. The clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. Music therapists use their knowledge, skills, training, and experience to facilitate therapeutic, goal-oriented music-based interactions that are meaningful and supportive to functional level and health of more than 40 client populations. So notice that the American Music Therapy Association was founded in 1950. They are hardcore in their education, licensure, professional documents, the evidence-based research. They are absolute leaders when it comes to the arts therapies, the CATs. And so we look to them as leaders. And music is extremely accessible and extremely powerful in the context of healing. And so um, we're very grateful for their leadership in that regard. And I've talked myself into it. This wasn't a very long lecture, but I want to add some YouTube clips that I can find so that you have examples to go with this. Um, Thanks for your time and your attention, and look forward to seeing you soon.